Hi, Kai. It is my honor to present our paper comparing perspectives on human and technology support for contact tracing. With COVID-19, the world has experienced a major global health crisis. Many countries have used contact tracing to help contain the spread of the virus, since an estimated 13% of people with COVID-19 are symptomatic. There are two major approaches in contact tracing. Digital contact tracing aims to identify, notify, and monitor close contacts, while human tracers typically perform the same function by directly talking to people via phone or video. We thus study contact tracing to explore the role of self-tracking technology in public health crisis. Studies have examined how self-tracking data can be aggregated to understand community-level health behaviors, but we have less understanding of how self-tracking technology can encourage people to contribute to disease surveillance and response. We ask two research questions. First, how do people perceive the respective strengths and weaknesses of these two approaches? Second, how does the contact tracing strategy influence people's willingness to share information collected during contact tracing? We therefore deployed the mixed method survey with 291 US responses in August 2020. We will describe a few oral findings, but we encourage reading the paper for our full set. Collectively, participants did not express a preference towards human or technology, seeing each having strengths and weaknesses. One participant said, "It doesn't make a difference to me personally. I understand fully why we need to have contact tracing, whether that is by human or technology. We need to gather the data and find a way to contain the virus." People perceive digital contact tracing as more effective for promoting privacy, convenience, and data accuracy. Human contact tracing offers benefits around data security, emotional reassurance, advice, and accessibility. For privacy, participants feel that technology allows for anonymity, providing people to be judged by human tracers for their COVID-19 status or background. One participant said, "If you feel embarrassed about something you have done or somewhere you have been, it is easier to give the information to the contact tracing technology as it will not judge you." For convenience, participants feel that technology could save interaction burdens by tracking data passively. It can also manage data at scale. One participant said, "I can report all of my data on my own time through an app." Technology has greater ability to capture data more accurately and avoid potential challenges brought by human entry. One participant imagined data inaccuracy brought by human, unreliable information from a person if their memory is not the best, if they forgot places they have been, or if they forget people they have been in contact with due to being distracted or disease such as dementia. People's unwillingness to share data with technology was often due to data security concern. Technology was associated with tech companies or the government at large, which were less trustworthy than public health department and easier to be hacked. One participant said, "App data is more frequently attacked than direct medical records. Information linked could violate HIPAA and privacy." For emotional reassurance, human tracers could empathetically understand people, carefully convey bad news, and help relieve negative feelings. One participant felt humans can feel empathy and emotions for people who have that disease. For advice, human tracers were able to provide further information about how to act when people are positive cases or close contacts. One participant said, "I will want to ask questions and get verifications on things you do not understand or even ask what the next stage was." For accessibility, one participant worried that many people do not have access to telephones or internet access and are likely already to be an risk group. So this is a very dangerous method because it leaves out this population. Also, some people would have difficulties to interact with technology. Although the use of contact tracing had little influence on participants' overall preferences towards digital or human, participants prefer technology when needing to report their health data every day during self-quarantine. One participant imagined being bothered by human tracer every day, while another participant felt it would be easy to log information daily in an app. Considering different affordances of these two approaches and the very context required for contact tracing, our work suggests value in solutions that combine the benefits of both humans and technology. For example, to support people that can reliably access smartphones and the internet, the system could mostly utilize self-tracking technology and skill. For those with accessibility issues, the system would mainly adopt the human tracing approach. Also, the system should involve a full range of stakeholders and more clearly indicate what stakeholders, such as technology companies or public health agencies, are involved in the deployment or have access to data provided. Thank you.